One of the biggest changes that has happened with IVF today is not just, using advanced technologies, but also at the same time thinking in a different way. So what happened earlier is usually we used to transfer multiple embryos, maybe two, maybe three, or maybe more in certain patients, because at that time our laboratories, our techniques were not so advanced. But today, when we have much higher and advanced technologies in hand, like advanced embryo culture systems, blastocyst culture, PGT or a genetic biopsy and analysis of the embryo, and thus a better control over embryo selection, we are slowly trying to move towards what we call an elective single embryo transfer. Because when we're transferring multiple embryos, maybe for better success rates, we at the same time we have to keep it in mind that there are chances of multiple order pregnancies, sometimes twins, sometimes triplets, sometimes even more if some clinician is actually transferring more than one or two embryos. This brings along with itself lots of risks for the mother and for the baby. So the baby can be premature, the baby can be low birth weight, the mother is at higher risk of hypertension and of diabetes. So in today's day, the goal of IVF is not just to give a pregnancy. We have to make sure that we hand over you a healthy baby, a live healthy baby. Whether you actually need to have a single embryo transfer or your clinician would prefer to transfer two embryos, that would depend on the age of the mother, on the embryo quality, your previous IVF history, and the whole clinical picture per se. So modern IVF is not just about transferring multiple embryos, but it is more about, selecting the embryo better and moving towards a single or maximum two embryo transfers.